Hello, good afternoon. Today I'm going to show you sample collection from a catheter for the Oscar scale. It is a 12-minute station and in a hospital setup. For this scale, you enter the room, check for safety, the scene is safe to approach, proceed. I do my hand hygiene using the 7 steps of hand hygiene by WHO. Okay, hello, good morning.
Good morning.
Yes, I'm Vincent Obita. I'm going to be your nurse today. Kindly, can I get your full names?
Sally Bloom.
Sally Bloom, and your date of birth?
1st to 4th, 1940.
Okay, thank you so much. Can I kindly confirm that with your wristband?
Sure.
Okay, thank you. I have Sally Bloom. Date of birth 04/04/1940. Hospital number 123, 45B, 45B, so I have the right patient. So Sally, can I call you Sally?
Sure.
Okay, thank you so much. Do you have any allergies to any medications?
No.
Okay, and any allergies to food, plaster, or latex?
No.
Okay, are you in any pain right now?
No.
Okay, I'm happy to hear that you are comfortable. So Sally, I'm here to take a sample from your urinary catheter, okay? Okay, this will help us determine if there is any abnormality with your bladder or with your urine. Is that okay?
Alright.
Yes, the sample will be taken to the laboratory and in 2 to 3 days you will get the result and we will communicate them promptly. Is that okay with you?
Okay.
I'll just prepare my equipment, then I'll be back. Is that okay?
Sure.
Okay, I'll do hand hygiene again before proceeding to my preparation area. And in my preparation area, I'll do a full hand wash with soap and water. Open the tap, wet my hands. Using soap, put sufficient amount of soap. Wet my hands palm to palm over dorsum, fingers interlaced, fingers interlocked, tip rotation, thumb rotation, wrist rotation. I rinse my hands. Using a paper towel, I dry my hands top to bottom to the general waist, top to bottom general waist. I close my hand I close the tap using my elbow. I'll then put on my apron. Assessor, is my tray and trolley clean and ready for use?
Yes.
Okay, thank you so much. So for the catheter sample collection, I'll require a sample bottle that has the patient details and it has no content. I'm happy to use. I'll also require 10 ml syringe. It is intact. Expiry date 2023. I'm happy to use. I will also require 2 chlorhexidine wipes. They are both intact. Expiry date 2023. I'm happy to use. I will also require a pair of clean gloves for my procedure. I'm happy to use. I will also require a hand gel. With that, I do hand hygiene. Then I proceed to the patient. So Sally, are you ready? We proceed?
Yes.
Okay, thank you so much. Now, assessor, I'm visualizing the catheter. It has no urine, otherwise I would have emptied it before the procedure. The urine is also free-flowing, so I'm happy to proceed and do the procedure. Otherwise, I would have manipulated it using the clean gloves. I do the hand hygiene. I will put on the clean gloves. Partially open the lid of my bottle top and also partially open the syringe. Then using the chlorhexidine wipe, the first one, I'll clean the pot where I'm going to take my sample. And this is the pot, not the one that the catheter was inflated. So I'll clean the pot for 30 seconds. Okay, Sally, you need to take note that while having catheter, you are predisposed to urinary tract infection. Is that okay? So you need to take note of signs and symptoms such as abdominal pain, okay, discharge discharge, urethral discharge. You can also get some some pain from the urethra, okay. In case you get such symptoms, kindly alert us immediately. Is that okay?
Okay.
Thank you so much. I'll discard this in the clinical waste. Then I wait for it to dry for 30 seconds while holding it. So sadly, you can also prevent the urinary tract infection by ensuring you take sufficient amount of fluid, that is 6 to 8 glasses of water per day to ensure you are hydrated. At the same time, maintain personal hygiene. Always clean yourself from front to back, okay? And you need to wash your hands, especially after coming from the washroom, with soap and water. Is that okay?
Okay.
Yes. The 30 seconds are over. I pick the syringe, connect it to the pot, and withdraw 10 mils of urine, and now I'll release the catheter. Sasa, can you confirm I have 10 mils of urine? Then now, without touching the key points, I'll open the sample bottle without touching also the inner portion and release the urine and close it without touching the inner portion. I discard this to the clinical waste and I'll put this one aside. So and then go ahead and clean the catheter point for 30 seconds. Okay. Thank you so much. So, Sally, we are done. Is that okay?
Yes.
Okay, I'll send the sample to the laboratory for analysis. Then the result will be back. In case you have any question, just press the call bell and we'll be back. Is that okay?
Okay.
Back to the preparation area. Assessor, I'll send the sample to the laboratory for analysis. I'll discard all the other equipment to the clinical waste. Remove my apron. Remove my apron to the clinical waste. Remove the glove. Then I do the hand hygiene. Assessor, I'll make the tray and trolley clean and ready for use. So, Sally, thank you for your cooperation. Okay. As I said, the results will be out in 2 to 3 days. Then we'll be able to inform you promptly. Thank you so much.
Okay.
Do you have any questions?
No questions.
Okay, thank you so much.